authors in a clinical psychology study investigate about the depression in people with obsessive compulsive depression using large sample of 87 patients, and they divided patients into groups without depression, with mild depression, with moderate depression, and with severe depressions of the base of preventive scores on the Beck Depression Inventory. The results indicate attenuated outcome only for the group with the most severe depression, but the presence of the major depression was not related to treatment failure per patient. Without depression had significantly lower post-treatment and follow-up by Yale-Brown obsessive-compulsive scale scores than did patients with additional diagnosis of depression. Clinical psychology study, the authors investigate about the family member response to a relative with obsessive compulsive disorder or any problem, and they call it like expression emotion and including emotional over involvement, hostility, and pervasive criticism. And these family interaction variables play a role as prediction for response to expression response prevention. Chambers to Skitty to conducted a study in which patients with obsessive compulsive disorder, patients with agoraphobia, together with their families, were administered measures of expression emotion prior to beginning treatment. The hostility was also associated with poor response in patients who completed treatment, and they suggest that when relatives express dissatisfaction with patient symptoms, but to the express personal rejection criticism, many have motivational properties. They exchange treatment response. Finally, for this clinical psychology study, the authors demonstrate that cognitive behavioral therapy using expression and response prevention is the most effective short and long term treatment for obsession compulsive disorders, but it is not the standard. The effectiveness studies suggest the expression and response prevention is transportable, non-research settings, and therefore should be a first-line treatment modality for obsession compulsive disorder in all settings. The motivation to begin treatment, especially given the anxiety evoking nature of expression and response prevention, is often a problem. This readiness program is which patients read case histories or discuss treatment with former patients might decrease refusal rate and increase treatment complaints.